Hey everyone, welcome back to our channel. In today's video we'll be discussing one of the most complex and multifaceted disease that can affect people of all ages, races, and backgrounds. Cancer. Overall, it's a critically important topic that touches the lives of millions of people worldwide. Throughout this series, we'll be exploring the various aspects of cancer, from its causes and risk, the different types of cancer and their symptoms, how it affects the body, what we can do to prevent and treat it, as well as the importance of early detection. We believe that knowledge is power and understanding, therefore, it's essential for both those affected by the disease and those working to find a cure. As such, this topic requires a comprehensive and compassionate approach, one that takes into account not only the medical aspects of the disease but also its social, emotional, and psychological impact on those affected by it. At its core, cancer is a disease characterized by the uncontrolled growth and spread of abnormal cells in the body. These cells can form tumors and invade nearby tissues and organs, potentially spreading to other parts of the body through the bloodstream or lymphatic system. It can affect virtually any part of the body and can have a profound impact on a person's physical, emotional, and social well-being. We understand that a cancer diagnosis can be a scary and uncertain time for anyone, but we hope that our channel can provide some comfort and guidance. Our goal and aim is to make our content accessible and inclusive to everyone while providing you with a comprehensive overview, thus sharing resources that can help you navigate and understand this complex disease. So whether you're a cancer patient, caregiver, healthcare professional, or simply someone who wants to learn more about cancer, we hope that our channel will be a valuable resource for you. So sit back, grab a healthy snack, and while you're at that, don't forget to like, share and hit that subscribe button. Turn on your post notifications, and start the journey with us, as we delve into the world of cancer. There are several risk factors that can vary or increase a person's likelihood of developing cancer. Some of the most common ones include: Number 1, age. As people age, their risk of developing cancer increases. Number 2, tobacco use. Smoking, chewing tobacco, or being exposed to secondhand smoke increases the risk of many types of cancer. Number 3, family history. If a person has a close relative who has had cancer, they may be at higher risk for developing cancer themselves. Number 4, occupational hazards. Exposure to certain substances in the workplace, such as asbestos, benzene, and formaldehyde, can increase the risk of several types of cancer. Number 5, unhealthy diet. A diet high in processed and red meats, saturated fats, and low in fruits and vegetables may increase the risk of cancer. Number 6, hormones. Hormone replacement therapy, HRT, and birth control pills containing estrogen and progesterone have been linked to an increased risk of breast and ovarian cancer. Number 7, alcohol consumption. Regular and heavy alcohol consumption increases the risk of developing several types of cancer, including breast, liver, and colon cancer. Number 8, sun exposure. Exposure to ultraviolet, UV, radiation from the sun or tanning beds increases the risk of developing skin cancer. It's important to remember that having one or more of these risk factors does not necessarily mean that a person will develop cancer. It's also possible to develop cancer without having any known risk factors. Therefore, it's important to talk to a doctor about any concerns or questions about cancer risk factors and prevention. While there is no single cause of cancer, certain risk factors can increase your chances of developing the disease, each with its own unique characteristics. Here is a brief overview of some of the most common types of cancer. Breast cancer. This is a type of cancer that begins in the breast tissue. It is most commonly diagnosed in women, but can also occur in men. Symptoms may include a lump or thickening in the breast or armpit, changes in breast size or shape, nipple discharge or inversion, and skin changes. Lung cancer. This is a type of cancer that begins in the lungs. It is often associated with smoking, but can also occur in non-smokers. Symptoms may include a persistent cough, chest pain, shortness of breath, hoarseness, and coughing up blood. Colorectal cancer. This is a type of cancer that begins in the colon or rectum. It is most commonly diagnosed in older adults. Symptoms may include rectal bleeding, changes in bowel habits, abdominal pain or cramping, and unintended weight loss. Number 1, prostate cancer. This is a type of cancer that begins in the prostate gland. It is most commonly diagnosed in men. Symptoms may include difficulty urinating, blood in the urine or semen, and erectile dysfunction. Number 2, ovarian cancer. This is a type of cancer that begins in the ovaries, which are female reproductive organs that produce eggs and hormones. Ovarian cancer. Symptoms may include abdominal bloating or swelling, pelvic pain, unintended weight loss, and changes in bowel or bladder habits. Number 3. Brain and nervous system cancers. These are types of cancer that begin in the cells of the brain or spinal cord. Risk factors for brain cancer include exposure to radiation, certain genetic conditions, and a weakened immune system. Symptoms may include headaches, seizures, vision or hearing changes, and weakness or numbness in the arms or legs. Number 4. Pancreatic cancer. This is a type of cancer that begins in the pancreas, which is an organ that produces digestive enzymes and hormones that regulate blood sugar. Symptoms may include abdominal pain or discomfort, unintended weight loss, and jaundice. Number 5. Kidney cancer. This is a type of cancer that forms in the kidneys, which are responsible for filtering waste products from the blood. Symptoms may include blood in the urine, pain in the side or lower back, a lump or mass in the side or abdomen, and fatigue. Number 6. Liver cancer. Risk factors for liver cancer include chronic hepatitis B or C infection, alcohol abuse, obesity, and exposure to certain chemicals or toxins. Symptoms may include abdominal pain or discomfort, swelling in the abdomen, unintended weight loss, and jaundice. Number 7. Bone cancer. Risk factors for bone cancer include certain genetic conditions, exposure to radiation, and certain medical conditions such as Paget's disease of bone. Symptoms may include bone pain, swelling or tenderness near the affected area, and unintended weight loss. It's important to note that while these are all risk factors, having one or more of them does not necessarily mean a person will develop cancer. It's also important to remember that many cancers can be prevented through healthy lifestyle choices and regular cancer screenings. Food to avoid that could greater your risk for cancer. There is no single food that can directly cause cancer, but consuming certain types of food regularly can increase the risk of developing cancer. Here are some foods to avoid or limit in your diet to reduce your risk of cancer. Number 1. Processed meats. Bacon, sausages, hot dogs, and other processed meats contain nitrates and nitrites, which can increase the risk of colorectal cancer. Number 2. Red meat. Eating too much red meat, such as beef, pork, and lamb, has been linked to an increased risk of colorectal, pancreatic, and prostate cancer. Number 3. Trans fats. Foods high in trans fats, such as fried foods, baked goods, and processed snacks, have been linked to an increased risk of breast and colorectal cancer. Number 4. Alcohol. Regular and heavy alcohol consumption increases the risk of several types of cancer, including breast, liver, and colon cancer. Number 6. Charred or burned foods. Cooking meats at high temperatures, such as grilling or frying, can produce cancer-causing chemicals called heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs. Number 7. High-fat dairy products. Eating too much high-fat dairy products, such as cheese, cream, and butter, has been linked to an increased risk of prostate cancer. Number 9. Refined grains. Refined grains, such as white bread, pasta, and rice, have been linked to an increased risk of colorectal cancer. Number 10. Canned foods. Canned foods may contain bisphenol A, BPA, a chemical that can disrupt hormones and increase the risk of breast and prostate cancer. It's important to note that it's not necessary to completely avoid these foods, but rather limit them and focus on a balanced diet that includes a variety of healthy foods. Eating a healthy diet, staying physically active, and maintaining a healthy weight are all important steps to reduce the risk of cancer. Food that can fight against cancer. While there is no one miracle food that can prevent or cure cancer, a healthy diet that includes a variety of nutrient-rich foods can help reduce the risk of developing cancer. Here are some foods that may have cancer-fighting properties. Number 1. Fruits and vegetables. Eating a variety of colorful fruits and vegetables can provide a range of antioxidants, vitamins, and minerals that can help prevent cell damage and reduce the risk of several types of cancer. Some examples include leafy greens, berries, citrus fruits, cruciferous vegetables like broccoli and cauliflower, Brussels sprouts and tomatoes. Tomatoes are rich in lycopene, a powerful antioxidant that may help reduce the risk of several types of cancer, including prostate and lung cancer. Number 2. Whole grains. Whole grains, such as brown rice, quinoa, and whole wheat bread, contain fiber, vitamins, and minerals that can help reduce the risk of colorectal cancer. Number 3. Legumes. Legumes, such as lentils, chickpeas, and black beans, are a good source of fiber and protein, and may help reduce the risk of colorectal and breast cancer. Number 4. Nuts and seeds. Nuts and seeds, such as almonds, walnuts, chia seeds, and flax seeds, are rich in healthy fats, fiber, and antioxidants that can help reduce the risk of several types of cancer. Number 5. Turmeric. Turmeric is a spice that contains curcumin, a compound with anti-inflammatory and antioxidant properties that may help prevent cancer. Number 6. Green tea. Green tea contains catechins, antioxidants that may help reduce the risk of several types of cancer, including breast, prostate, and lung cancer. Number 7. Garlic. Garlic contains compounds that may help reduce the risk of several types of cancer, including stomach and colorectal cancer. Number 8. Mushrooms. Certain types of mushrooms, such as shiitake and maitake, contain beta-glucans, compounds that may help stimulate the immune system and prevent cancer. Number 9. Fish. Fatty fish, such as salmon, mackerel, and tuna, are rich in omega-3 fatty acids, which have anti-inflammatory properties and may help reduce the risk of several types of cancer, including colorectal and prostate cancer. Number 10. Dark chocolate. Dark chocolate contains flavonoids, antioxidants that may help reduce the risk of several types of cancer, including colorectal cancer. Number 11. Olive oil. Olive oil is a healthy fat that is rich in antioxidants and may help reduce inflammation in the body, which can help reduce the risk of several types of cancer, including breast and colon cancer. Number 12. Pomegranates. Pomegranates are rich in antioxidants and contain compounds that may help reduce the growth of cancer cells, particularly in prostate cancer. Number 13. Citrus fruits. Citrus fruits, such as oranges, grapefruits, and lemons, are rich in vitamin C and other antioxidants that may help reduce the risk of several types of cancer, including breast, stomach, and esophageal cancer. Number 14. Ginger. Ginger contains compounds that may help reduce inflammation in the body and inhibit the growth of cancer cells, particularly in ovarian cancer. It's important to note that while these foods may have cancer-fighting properties, they should not be relied on as a cure or prevention method for cancer. A healthy diet, combined with regular exercise and other healthy lifestyle choices, can help reduce the risk of cancer and improve overall health. If you are concerned about your risk of cancer, it's important to speak with your doctor and get regular cancer screenings. Symptom of cancer. The symptoms of cancer can vary depending on the type of cancer and the stage of the disease. Some common symptoms of cancer include persistent or unusual pain in any part of the body that doesn't go away with over-the-counter pain medications, unexplained weight loss, particularly if it is significant, a persistent cough or hoarseness, difficulty swallowing, or dysphagia, changes in bowel or bladder function. Symptoms may include blood in the stool or urine, changes in bowel movements, or difficulty urinating, changes in the skin color, size, or shape of a mole or other skin lesion, such as jaundice or excessive itching, shortness of breath or difficulty breathing, swelling or lumps in any part of the body, such as the breast, lymph nodes, or testicles. It's important to note that these symptoms can also be caused by conditions other than cancer. Question: how well-rounded is your knowledge? Let's put it to the test in this exciting section. It's time to flex your brain muscles with these trivia questions. Let's add some fun to your learning journey. Number 1. What is the most common cancer in men? Answer is prostate cancer. Number 2. What is the most common cancer in women? Answer is breast cancer. Number 3. How is cancer diagnosed? Answer is cancer is usually diagnosed through a combination of medical history, physical examination, imaging tests, and laboratory tests, such as blood tests or biopsies. Number 4. What is the difference between a benign tumor and a malignant tumor? Answer is, benign tumors are not cancerous and do not spread to other parts of the body, while malignant tumors are cancerous and can invade nearby tissues and spread to other parts of the body. Number 5. How does cancer spread? Answer: cancer can spread through the bloodstream, lymphatic system, or by invading nearby tissues. Number 6. What is immunotherapy? Answer: immunotherapy is a type of cancer treatment that uses the body's immune system to fight cancer. Number 7. What is precision medicine? Answer: precision medicine is a type of cancer treatment that uses genetic testing to identify specific mutations in cancer cells and target them with personalized therapies. Number 8. What is the most deadly form of skin cancer? Answer is melanoma cancer. Number 9. What is a mastectomy? Answer: a mastectomy is a surgical procedure to remove all or part of the breast tissue, often used as a treatment for breast cancer. Before we end, let's quickly recap the key takeaways from this video. Each type of cancer can have its own unique set of risk factors, symptoms, and treatment options. It's important to work with a healthcare professional to understand your risk of developing cancer and to develop a plan for prevention and early detection, as early detection can greatly improve treatment outcomes and survival rates. Remember, prevention is always the best medicine. However, while we acknowledge it's normal to feel overwhelmed, devastating both emotionally and mentally, scared, and uncertain when faced with a cancer diagnosis, the importance of a positive attitude, strength and resilience, maintaining hope while surrounding yourself with a strong supportive system, that can improve your outlook and increase your chances of a successful outcome. Of course, there are many things you can do to reduce your risk of developing cancer, such as maintaining a healthy lifestyle, avoiding tobacco and excessive alcohol consumption, and protecting yourself from harmful environmental factors like UV radiation. We hope that our videos provide you with the information, inspiration, and support you need toward making a positive changes to a happier, healthier lifestyle. Thanks for joining, and remember, you are not alone in this fight. There is always hope for a brighter future, by taking proactive steps to protect your health. Finally, we want to emphasize that our channel is not intended to replace medical advice or treatment. If you have any concerns about your health or experiencing symptoms, please consult with a healthcare professional. Our goal is to provide you with information that can complement your medical care and help you make informed decisions. Your feedback and input are important to us, as we value the insights and perspectives of our viewers. Let's work together to create a supportive and informative community that can make a difference in the fight against cancer. Together, we can make a difference in the lives of those affected by cancer. We wish you all the best on your journey. Feel free to engage with our community by sharing your thoughts with us in the comments section below. So, take care of yourself, stay positive, and keep exploring the best life has to offer. Thank you for watching. Don't forget to share, subscribe, and hit the thumbs up button for more interesting videos like this. See you all in the next exciting video. Thank you for watching.